Welcome to Getting Wiser with Dr. Wiser. If you had breast augmentation or you have breast implants, this video is for you. Today, I'm going to talk about how to keep it safe for the long term with your breast implants. The first thing you need to know is that you need to have yourself a routine schedule of exams and follow-ups on your breast implants. Either with a breast surgeon, preferably a plastic surgeon or radiologist. You need someone who's going to examine your breast, examine the implants, and also perform an imaging, whether it's an ultrasound or an MRI to the implants. And why is that? Implants have a tendency up to 50% in 10 years to tear, to rupture. And this rupture can lead to other unwanted results. The physician will examine you and look for the following three things. One, capsular contracture. Capsular contracture is basically a deformity of the breast caused by the capsule around the implant contracting. Every implant has a capsule formed around it. It's a natural response of the body. And in some patients, because of, we think, infection or chronic irritation, this capsule starts to contract around the implant and deforms the breast. And in very severe cases, it also causes chronic and intermittent pain. And it's easy to identify and also to treat. The second thing a physician looks for in an annual exam of breast implants is symptoms of breast implant illness. Breast implant illness is a new syndrome that emerged into our lives several years ago. And it basically describes non-specific symptoms that are associated with the presence of breast implants. These non-specific symptoms include things like joint pain, brain fog, muscle pain, weakness, and all-around day tiredness. So the solution that is offered today is basically taking those implants out. And in the majority of the patients who report those symptoms, we see some sort of an improvement. The third thing a physician will look for in an annual exam of breast implants is to rule out ALCL. What is ALCL? ALCL is a rare type of lymphoma that forms around the breast implant, specifically in the capsule. It's very rare. We only have in the last 15 years a little bit more than 1,000 cases reported. And the first early signs of it are basically a change in the volume of the breast caused by accumulation of fluid around the implant. We call it seroma. An annual exam can detect it early. And what I do is I just do an ultrasound exam right there and then at the office. And I can, if I see and identify a seroma, I can basically take a little exam from it and send it to the lab. And then see the cause of it and rule out ALCL. I encourage you to click on the link below and schedule a free consultation with me to learn more about it.